there's obviously a booby trap that has been installed in many of our minds where, because of what I now regard as the absurd portrayal of anti-vaxxers as a simple monolithic phenomenon, many of us have difficulty wrapping our minds around the possibility that something that we've been told is a vaccine could possibly be doing massive levels of harm, which is absurd because obviously many vaccines have not gotten past trials on the basis that safety signals emerged. Others have been pulled from the market after adverse events signals showed that they were unsafe. So they're not inherently safe products. And I think it took many of us some time to get past the idea that effectively anti-vaxxers were free riders who were getting the benefit of other people's taking a small risk and being vaccinated. They were getting the benefit of those people's immunity, which in fact is, I'm certain, a part of the phenomenon. But others had legitimate concerns, which frankly aren't easily dismissed in one fell swoop.
Yes, completely. I think what's interesting is people have asked me, why did you've been a big critic and skeptic of drug industry. Why did you take the vaccine at the beginning? And of course, it was complicated reasons for me personally, both on a personal level, but also on the fact that I can, I'm not a vaccine expert and I didn't even predict or expect this would happen. But I think that, what I would say certainly is that many people at the beginning, Brett, I would say didn't take the vaccine for irrational reasons. And the people who are now deciding they don't want boosters or whatever else, so many of them are not taking it for rational reasons. Because some of those original thoughts around the vaccine, okay, we don't know the long-term effects, but then we don't know the long-term effects of many things, right, at the beginning. We didn't really have very strong data at the very beginning on the harm, certainly not high-quality data. So a lot of that was maybe intuition. It could be people were buying into things that really are quite ridiculous, I think, such as it's part of a depopulation agenda. There are microchips in the vaccine. Many of the people who didn't take it were taking it, not taking it for those reasons. So I don't think, certainly for me as a cardiologist, although I could have been more skeptical and taken longer to make a personal decision on it, I wouldn't have been able to have the data that I was able to produce in that paper a couple of months ago. I didn't have that data at my disposal at the very beginning to make a very clear decision that this vaccine is going to cause significant harm and doesn't have much benefit. It took time for us to gather that information.
It did, although I came at this from a different route. I knew full well that there was a problem with pharma. I knew that if I opened, because of the experience with mouse telomeres, I know that when I open my medicine cabinet, I see a bunch of question marks. And even as somebody who's well informed about the issue, I'm in no position to say which of those question marks are filled in with a hazard I can't see and which of those pills might be safe. So, I was on alert. But I think the larger, there's a question about what you call irrational. Now, the microchip allegation is irrational. It's counter-rational, I believe. On the other hand, I don't feel that way about somebody who decided not to take it on the basis that they are aware that our system is corrupt and therefore what they're being told about safety may well not be true. Kind of meta-rationality.
That's rational. No, that's rational. Yeah. Vaccine hesitancy, absolutely.
Yeah. So, okay, good. I'm glad we're aligned on that.
Actually, interestingly, when I went on Good Morning Britain, I actually addressed it. I said there are rational and irrational concerns about the vaccine. I said the rational concerns are exactly what you said, Brett. Because let's look at the history of pharma. Their business model is fraud, and this is what they've done. We've got an issue of the third most common cause of death after heart disease and cancer are prescribed medications, and that is rooted in pharma corruption. So I said that's completely rational, absolutely.
Yeah, it is rational. I will say it's an interesting pattern that I've noticed among the COVID dissidents, you included. is how many of the COVID dissidents are in fact inoculated with these vaccines for COVID-19. So even people who were well positioned to see it, the ramping up of the campaign was so rapid and the messaging was so black and white that I think even people who were primed to be able to
Yeah.
detect it got caught off guard.
Yeah, and I think that for me was when things turned for me, is when they suddenly, when I started looking obviously the potential harms, but when they turned it into mandate and say ramping up the campaign, then I knew that there was a problem. I knew there was an issue, and certainly I knew then it was more about profit than protecting people,
Yeah.
right? And that's when I campaigned and I did help to some degree. I was a very prominent campaigner to get the vaccine mandate overturned for National Health Service staff. I spent months, both in mainstream media and behind the scenes making that happen. So I knew that was taking things way too far. Absolutely. And then the final point, I think, as well, Brett, is I find it very difficult to believe that Pfizer scientists didn't know by the end of their randomized control trial, before the drug was approved, that this was going to cause significant harm to many people. And I wonder, is that why they were so strong in getting indemnification from governments against, being liable if there were, vaccine injuries? I find it very, very difficult to, which means if that is correct, Brett, it should never have been approved in the first place.
Should never have been approved. And, one piece of evidence that is suggestive you're right about this is that the discovery after they were released about how much harm they do hasn't changed things a bit from the perspective of, pharma has not become cautious over them. So there's no reason to think that they learned about those harms late, since it didn't change their trajectory at all.
Oh yeah. Well, a psychopathic entity won't change, right? They have to be forced into a position where, they are made accountable.
It's quite right. Two final things from my side. You're welcome to enter anything in the discussion that you want to. Are you concerned for yourself, having gotten a double dose of the Pfizer vaccine?
Great question. I think that I'm an optimist. I think that certainly from what we've seen, most of the serious adverse events tend to happen early on. Of course, with the exception maybe of coronary artery disease progressing, et cetera, in people who already have underlying coronary artery disease. I think there's wishful thinking. I'm hopeful that I'm probably okay, and I think most people should also feel that way. But the honest answer, Brett, is we don't know.
Yeah.
But what good is that going to do? I think psychologically worrying about something that hasn't happened isn't of any benefit right now. In the same way that we don't worry, we're all going to die. So why worry about death? When it's not something that's imminent, why worry about it?
Well, I am a fan. It's my own invention, so maybe I'm not a fan, but I am personally, I advocate for what I call adaptive dwelling, which is to say you should dwell on something exactly to the point that dwelling on it further doesn't do you any good, at which point you should abandon it. And what I would say is there's one way in which I think a little bit of dwelling is probably valuable. And believe me, I don't want people worried about something that's in the past and can't be undone. What I do want people to understand, which I suspect it's not well known in public, is that this is not the place for I'm already vaccinated, what can I do style of analysis. The point is they're continuing to push boosters on people and new versions. And everything I understand about this suggests that the risk, through one of a couple different mechanisms, and maybe they're both in play, the risk is likely to be cumulative. We've seen that to some extent in the data, but at the very least, maybe you got away with it. If you got away with it, keep yourself as safe from this stuff as you can.
Absolutely. No more. And I think also, obviously, my duty and responsibility as an advocate and a doctor is to make sure no further harm happens to anybody else. And that's why I was so strong on this, because people would say to you, so people will say, well, hold on, your dad died. What can you do? You can't bring him back. I said, hold on, my responsibility is to make sure that doesn't happen to anybody else. I think the other thing as well that people can think about, Brett, is it does appear certainly with COVID and even maybe with the vaccine, the people who are most vulnerable to side effects are people who are already in poor metabolic health. So they have conditions related to excess body fat. So one of the things that people can do certainly is just get themselves in better shape, because if these effects are pro-inflammatory and related to conditions like heart disease, your best counter is to institute lifestyle changes that are going to mitigate or minimize those risks. And I think that's something that people can proactively do. That's something I follow my own advice. And certainly some of my patients with long COVID have got significantly better once they've lost weight, they've improved their diet, and their symptoms have improved. So I think we should all focus on making sure our baseline health is as best as possible as it can be. And maybe one of the downstream, or maybe one of the effects of all of this, certainly something I highlighted I was very vocal on at the beginning of the pandemic, highlighting the link between obesity and adverse health outcomes, is that moving forward, actually, if we're going to make the population more resilient for the next pandemic, God forbid it happens anytime soon, is to make our metabolic health as best as possible through dietary changes, getting good sleep, going back to the basics, keeping stress levels low, meditation. I'm sure these are all things that you are a strong proponent of.
Of course.
And that's what I would say people can do and be proactive about.
Yep. I would also say, this was a very painful way to learn certain things. In the book I mentioned before, Hunter-Gatherer's Guide to the 21st Century, not only did Heather and I say that we thought vaccines were one of the three great medical interventions in all of history, which I still believe, though now with a caveat, but we also took a strong position against the likely utility of supplementation, on the basis that by and large a good diet ought to provide you what you need, which is something I now do not believe. I know better, in fact, in at least one case where most of us are chronically deficient in vitamin D because diet is not the mechanism through which you procure it. And our lifestyles block us from the contact with the sun that would produce normal amounts of it, our clothing, the windows that shield UV, the fact that we live indoors. All of these things cause us to be chronically deficient, especially if we live at high or low latitudes. And so in any case, I'm coming to understand that my model was too simple also. A good diet means you don't need to supplement and there's no benefit. The only reason you need to supplement is if you're deficient. That part is true. But a lot of us are deficient and maybe in more than one thing because our highly novel lifestyles block the normal way in which we'd accrue these things.
Yeah, 100%. And vitamin D has so many important roles in the body as a prohormone, not just in bone health, as you mentioned, in the immune system, but even in heart health. The vitamin D deficiency is associated with a 6-fold increased risk of developing coronary artery disease. So, I'm with you 100%. And if you can ideally get it from getting some good sun exposure. But if not, then certainly through winter months, or if you're in a place where you don't get much sun exposure, then supplements are definitely the way forward. I'm 100% an advocate of vitamin D.
Yeah. Well, I'm also an advocate of leveraging technology. There's an app, there may be more than one, but I use one called D-Minder, which tells you actually during what hours of the day you are capable of making vitamin D from sun exposure. Simply being in the sun doesn't do it. And the angle of the sun, you'd be surprised. I'm now in a phase, as I would imagine you are. You're in Britain, in which it's impossible to make vitamin D, no matter how much sunlight you're exposed to. And just simply having a calculation that tells you, okay, I did pretty good over the summer making vitamin D, but I should be supplementing because I can't be making it until I think sometime in late February. That's an important piece of information to have.